Welcome to the QiiQ Virtual Assistant. It's just an interface we have for accessing patient data that's on the EHR right on my phone. The idea is that I'm able to quickly go between patient encounters and between patient rooms and quickly pick up any pertinent patient detail quickly on my mobile device. Just a disclaimer about this data. This is all synthetic data. There's no real patient data that's exposed in the demo. And keeping in mind that because this is synthetic data, you'll see information that's not typically representative of a typical ED patient. So for this demo, I'm going to search with two patients that I'm going to be seeing in the department today. I'm going to go click on the search button and just type in this one patient that I'm seeing, a young girl who's presenting with an abdominal pain. Her name's Amy Shaw. And when I go into the initial summary, this is just some information that's already pulled up on her. If I went into encounters, I could actually select this encounter and add it to my list. And I could scroll down and see quickly here that she does have abnormal vital signs of fast heart rate and temperature, a little bit of a low blood pressure, but I'm not making too much of it right now, just as I'm seeing. Labs are already back on the patient, but I'm assuming that this encounter is coming in as I'm seeing her. So if I wanted to go look at more of the labs, they're all organized here. I could see her vital signs, and I do have two sets of vital signs that are in here. You can notice that her heart rate here of 105 and 95, and her temperature's kind of going up. And radiology reports saying, like, now that I've already done my studies, I could see my radiology reports, notes that were already on the patient. So this only has a triage note. If I see that it says that the patient presents with lower abdominal pain for 3 days, which is worsening. The patient any allergies, she doesn't have any here, any past medical history, conditions, and any medications that she's on. So I would say that I've already seen the patient, worked her up. Obviously the labs are all back. If I go to radiology, I could quickly pull up her ultrasound that was done on her abdomen. And in her case, it's showing the abdominal pain with the rule-out appendicitis was the indication. And if you read through the report, it's confirming the diagnosis of appendicitis. So the idea is that I'm going between the patient rooms, and by the time as this information is coming back, I am able to quickly grab it and take action. So now I'm going to do another quick example of another patient. And this patient here is one that's coming in with head injury. So let's say I'm going to take Vanda Danesic, who again I'm going to look at her encounter, and she's here for head injury. So I'm going to add the patient to my list. I just want to point out, if I go back to my rooms that I've added these patients, I'm seeing their current length of stay. There's some indicators on here about their severity status. So Vanda Danesic was been triaged with a little bit of a higher acuity, so she's got an orange status bar, and Amy Shaw's got more of a level 3 chart, and she's got a yellow bar. Mr. Filberto, who's here for a very long time, actually has a gray bar because it's not defined. He's also a test patient with not really a chief complaint pertinent to an emergency visit. So I also see other elements on this page about all patients. Could be also in the rest of the department, or if there were any in the waiting room, I could see those as well. So going back to Miss Danesic's chart, I can see she already has some labs back as well. Nice little feature on here. She has a some labs here that I think are interesting. I could click on her lactate. Unfortunately, there's only one on there. I can't trend it. But if I wanted to, I could look at her sodium over time. Again, there's only one. This is a better, if we have multiple values. This one is creatinine over time, has not changed from 1. And perhaps her glucose. There we go. There's a good example of values that have changed over time, and I could quickly see how her glucose has been under control, a little bit high a couple of times, but otherwise generally well under control. So I'm still curious why she was such a high elevated patient in severity. So I'll quickly look at the triage node. So she fell from standing, loss of consciousness, and she has a depressed mentation. And she's on a blood thinner. So that kind of tells me, right again, palm of my hand, why this patient's here and why I should be quickly going into the room. No other notes on the patient, allergies, conditions. I guess not as important right now. And radiology, looks like she's already had a CAT scan of her head. And this is a brief one. It's just showing that's actually a subdural, so she has a brain bleed. So again, this shows the utility of how quickly I could get my information at the tips of my hand and act upon it. So those are the basic functions of looking into the chart. And there's a couple of other features here that we could do that have to do with this mic button down here. So I could actually go into the chart directly from the patient list and pull up specific information. So we talked about the glucose before on Mr. Nesic. So I could say, show me the glucose for the past 5 years for the patient in room F15. So pulled up all the glucose for the past 5 years. I could still click on it and show all the trends over the past since the inception, but it's pretty clear that it's pulling up the labs that I really wanted to. Then I could do other things like showing the general labs or vital signs. Show me the vital signs for room C7. And there are her vital signs. We confirm her name, so we know we're on the right patient. And going back to the patient list, I guess the other functionalities that we could do on here are supposed to build on the whole natural language processing. So eventually we're going to be able to dig into more elements of the chart, do a little more complicated filtering right from the get-go without having to drill into the EMR and having to deal with pesky drop-downs and pop-up menus just to try to get to the data that we really want to. So those are the current features right now of the demo. We're looking at doing some, adding some additional features which we're currently working on. One of the ones that we mentioned earlier was having the alerts on anything that's coming in. So new vital signs, new labs, new reports are going to be notified directly on the phone using the native APIs of the operating system. So you'll get the notification in the notification center as well as in the app. If you're wearing a smartwatch, that'll also ping your watch and let you know that there's something new. And that'll just drive you right into the new result that needs attention. We'll also have a messaging platform that allows you to communicate with nurses or other providers that are also using the app, and allow you to write a message directly to the provider in the context of the patient, so they know exactly who you're talking about and what you're trying to relay to them. We'll also be able to search for patients directly using their barcodes on their wrists or their patient labels. So that's another quick way to pull up a patient. Also, the goal is to be able to write additional notes using the voice dictation. So sometimes you just want to come out of a room and jot a couple of notes down before you forget anything, before you start having to type the whole note. So our whole goal was to make the workflow in the department a lot better. We looked at a lot of things that, a lot of elements that disrupt the typical ED workflow, and we designed the assistant to address these and allow the physicians to continue their current task without interfering too much of what they were previously doing, and that should reduce errors and improve the times to respond. So I can now move faster through my patient list, and I have a better idea of what's going on in the department, and I'm a lot more confident that I'm not going to miss something important that's going on, especially without having to go back to my workstation in order to get the latest information. So ultimately, the patient gets better care, it's faster care, and they go home with a better experience and better outcomes. So we're in pretty rapid development cycle right now and putting out lots of new features. So other than the ones that I mentioned before, a lot of our long-term features include writing or dictating notes directly on the device and go right into the EMR, be able to have order integration so you could act on a critical lab and just place the order right on the phone. Also see the status of any of these orders. So the vision is to actually not only be able to receive instant results, but take immediate action and prevent the unnecessary steps of having to go back to the EMR, to the workstation, just to perform that step, which are fully full of risks and errors. So instead, physicians could be suturing a wound and receive a notification, perhaps that their patient has a elevated white count on a lactate, and now they're able to order antibiotics and communicate to the nurse without leaving the room. So our goals now are to get this into a pilot study, pilot hospital, so that we could further develop this and get feedback directly from the physicians and those using the software to make this into the tool that they want to use. So make sure to register yourself or your hospital with QiiQ and join us in this critical pursuit of an emergency department transformation.